Greetings and welcome. I Love Iodine here with another video on intestinal parasites. This video is going to cover the common symptoms of intestinal parasites along with some related health issues. This is just one video in a series. The other topics are listed here and you will find videos on these topics in the intestinal parasites playlist. Disclaimer. The information provided is for educational and informational purposes only and is not intended as a substitute for advice from your physician or other healthcare provider. The information in this presentation is not to be used or relied upon for any diagnostic or treatment purposes. I am not a medical practitioner, and I am not offering any medical advice. This information is from my personal experiences as well as my own independent research. Please consult your healthcare practitioner if you have or suspect you might have a health problem. I personally was infected with tapeworms and intestinal flukes. I also have a master's degree in research methodology. I have had coursework in parasitology, though I am not a parasitologist. And I've also had extensive coursework in nutrition, though I am not a nutritionist. That being said, let's discuss some symptoms that are common for those suffering from parasitic infections. Parasitic infection symptoms overview. Parasitic infections cause many of the same symptoms attributed to many autoimmune disorders and other health issues. Regarding autoimmune disorders, this is logical as your body is not attacking you, but rather attacking the invading pathogens. Thus, you are going to test positive for an antibody reaction. If one does not realize that they have parasites living inside them, then they may believe that the body is attacking itself. But it is not. It is doing what it's supposed to do. It is attacking the actual pathogens. Until one realizes that parasites are a possibility, one can't actually get to the root cause. So if you have an autoimmune condition and you have never addressed the possibility of a parasitic infection, in my opinion, I think that would be wise to do. If parasites are the true cause, treating the symptoms will not restore your health. Avoiding foods will not restore your health. Adding in more nutrients to try to mask the symptoms of what is being stolen by the parasites or be able to lessen the damage that's being done is not going to restore your health. That being said, that's just my opinion, but if that is what I do, that's how I've come to be able to deal with my own problem. Not only when you have parasites, it's not just part of the issue is getting rid of them. But then the next part, you have to replace all of the nutrients that were lost. If you had a parasitic infection like I did for many, many years, parasites do a lot of damage. They steal your nutrients for numerous years and they also toxify your body. Anyway, that being said, we're going to move on so we don't make this video too long. The next two slides are just going to discuss a few articles where protozoan parasites are linked to health issues. This article here links a protozoan parasite to colitis. If you're interested in reading this article, I'll be putting the links to this article and all websites that are referenced in this video in the description box below. This article here I want to discuss a little more in detail because it's discussing the Toxoplasma gondii, which is also a protozoan parasite, being linked to Crohn's disease. Toxoplasma gondii is a parasite that causes an infection called toxoplasmosis. Toxoplasmosis has been linked to very serious health issues, especially for pregnant women. If a woman becomes infected with toxoplasmosis during pregnancy, she may experience birth defects in her child, including microcephaly. For other people, Toxoplasma gondii has been linked to causing headaches, seizures, schizophrenia, and other mental health problems. I want to mention that according to the World Health Organization, 30 to 50% of the world's population is infected with Toxoplasma gondii. This is not a third world problem, this is a worldwide problem, and we get it from cats. So cats are the main ways that we can get it, and how they get it is they become infected because they eat mice and they eat birds, and then of course they become infected and then they pass on the parasite through their feces to us. Another thing to consider is many dogs like to eat cat feces. So if you're out walking your dog and your dog is eating the cat feces, I'm not exactly sure if it can be transmitted that way, but that's definitely something to consider. Also, since we know it's transmitted in the feces of cats, if a cat is outside and the cat feces is in someone's yard, of course, by stepping in it or getting it on you, you can infect yourself. If you're changing the cat's litter box, be very, very careful. But one needs to be very careful about cats living in the house. If cats are living in the house, they're not wiping their feet after they get out of the litter box, and thus they may have their own feces on their feet, and they could be transmitting the parasitic infection throughout your house and onto your furniture and onto you. These are just things to keep in mind. According to an article that I highlight in my video called Parasites in the News, approximately 10 to 15% of the people are estimated in the United States to be latently affected with Toxoplasma gondii. Toxoplasma gondii is a type of infection that can lay dormant in your body for years, and it will wait until your immune system is compromised, and then it will show up. So these are things to be really well aware of. I mean, this might be something that you've been carrying around for many years, so maybe you had a cat a long, long time ago. Don't think that you have no risk just because you no longer have a cat. I'm not trying to scare anybody. I'm just trying to present some information. So if someone does get sick, this is something they can say, oh, well, maybe we can treat this first, and then that will save a lot of time, money, and also help your health stay healthier in the end because you won't be sick for a long time chasing the symptoms. Next, we're going to discuss symptoms of tapeworm infections. Tapeworm symptoms, according to the CDC, which is the Center for Disease Control and Prevention in the United States, the Mayo Clinic, also located in the United States, and the NHS, which is the National Health Service in the United Kingdom. According to these sites, most infections are asymptomatic. I can attest to that because I was also asymptomatic for many years. The symptoms they have listed that I put together are abdominal discomfort and pain, pain above the stomach or in the abdomen, called the tummy, according to the NHS. Diarrhea. This is would make logical sense as the body is trying to send water and fluids to the intestinal tract to flush out the pathogens. If it can't succeed, it's going to continuously do that, and you're going to have chronic diarrhea. Another symptom is dizziness. Another symptom that's very common is nausea. Vomiting can occur as well. In my case, I had that only one time, so that is not necessarily a very common symptom. Jaundice, that is being yellow or yellowing in the skin as a result of a liver that's not functioning properly, is also a common symptom of tapeworm infections. This can be seen in the eyes, so if someone has yellowing in the eyes, especially in the corners, or if they have a yellowing in the skin, maybe they need to check in with their doctor about having an issue with their liver and maybe checking to see if that issue could be caused by parasites. Another issue that tapeworms can cause is they can actually cause gallbladder disease by causing a issue where the proglottids, which are the segments, migrate. They block it. They block that bile duct. They can cause inflammation there. Another thing that the proglottids can cause is when they move around, they can cause an intestinal obstruction. They can maybe ball up. So these are very, very serious things. And like I said, with most infections being asymptomatic, the parasites are still robbing you of your nutrients. So it only is a matter of time, if you don't address the parasites, that they are going to cause health issues. It may not be observed by your doctor that it's a parasite causing it, because they might just diagnose the symptoms as maybe hypothyroidism, as the case was for me, or some other issue, like I had issues with women problems. So instead of them thinking you had a parasite, they prescribed hormones to replace the hormones that weren't functioning properly. I did not take those because I knew that there was something else causing them. I decided to trust my instincts, and I knew that there had to be something as a root cause. And of course, for me, it was parasitic infections. So I'm taking this information and sharing it. Anyway, back to these things before I digress off onto a new tangent, is another symptom is insomnia. That can be very common, especially the parasites are, maybe they're hungry and they want to eat, maybe they're awake, they're active, maybe that can disrupt the sleep cycle. A very common thing is to have an increase in appetite. This is especially seen for people infected with beef or the pork tapeworm. Also can be seen as a loss of appetite. If you're nauseous, you might not want to eat. Before we get to the deficiencies, I want to say that weight loss is possible. That happened for me, but then I slowly put on weight as my thyroid began to function improperly, and I became hypothyroidism. I actually started to put on weight. So even though I had a parasite eating a lot of my food, my metabolism wasn't working properly. Anyway, just wanted to note that. So don't think that a tapeworm diet is a good idea, because it is not. So a vitamin B12 deficiency is very common for people infected with fish tapeworms. We can get fish tapeworms from eating sushi and sashimi. It's very, very common from eating the raw fish. And vitamin B12 deficiency can lead to things as pernicious anemia, and this can be very, very serious. If it's not treated, or if it goes on and becomes very serious, it can actually cause permanent neurological damage. We can also see, of course, malnutrition, but of course, from the minute we get it, it's actually stealing our nutrients, so malnutrition would follow. And of course, it's going to cause an inadequate absorption of nutrients and foods. And the reason I have that listed twice is because it actually can block our intestinal villi, like the sites, from us getting the food, because it's actually physically in the way. So it can actually not allow that to be absorbed. Also, as we're going to see in the next slide, we'll see that it actually can cause our digestive enzymes to not function properly because they're not being released by the gallbladder. So this is definitely a very, very big thing if you think about having parasites and you think that you would know right away. Well, clearly, according to these 3 sites and from a personal testimony of someone who was in fact infected for many, many years, you can go many years and have absolutely no idea. Now we're going to discuss the gallbladder. We mentioned a few of the issues that parasites can cause, but I wanted to go over a little bit more about the anatomy of the gallbladder and a little bit of the functionality. So as we can see from this picture where the gallbladder is located, it's located near the liver. And if we see this larger diagram here, we see where the duct comes down. And we see the small intestine, this duodenum. We're going to talk about that on the next slide, but just keep that in mind. But let's discuss the gallbladder. It is a small pear-shaped organ on the right side of your abdomen beneath your liver. The gallbladder holds bile. Bile is a digestive fluid that's released into your small intestine. This assists with fats, also known as lipids, being digested and absorbed in the gut. It also aids the body in excreting waste products from the blood. So as you can see, this is a very, very serious issue if we have parasites that are disrupting the normal functioning of our gallbladder. That being said, we're going to talk about the duodenum. Again, we see that it's this little pouch. Oh, I don't want to call it a pouch. It's where the small intestine meets the stomach. So it's a little section there. The issue here is this is the principal site for iron absorption. And there are intestinal flukes that like to actually harbor, and that's where they are located. They like to live in your duodenum. We can get these intestinal flukes by consuming raw or undercooked food, especially fish and bivalve mollusk. We can think about bivalve mollusk as being raw oysters, and of course fish if we're eating sushi or sashimi. That being said, you can check out my other videos where I discuss how you can reduce those risks by properly preparing those and properly freezing the fish before you consume them. Vitamin B12 deficiency. Parasitic infections can definitely cause a vitamin B12 deficiency, especially for those people infected with fish tapeworms. Symptoms of a vitamin B12 deficiency include weakness, tiredness, lightheadedness, heart palpitations, shortness of breath, reduced heart function, pale skin, a smooth tongue, constipation, diarrhea, a loss of appetite, gas, nerve problems, numbness or tingling, muscle weakness, or problems walking. Vision loss is another symptom. Mental problems like depression, memory loss, or behavioral changes. Another symptom can include changes in reflexes, poor muscle function, decreased taste, low red blood cells. That's anemia. If you don't have enough red blood cells in your body, you're not going to be able to deliver oxygen throughout your body effectively. Decreased fertility is another symptom of a B12 deficiency as well. According to the National Institutes of Health, the symptoms include fatigue, tiredness, shortness of breath, dizziness, headache, coldness in your hands and feet, pale or yellowy skin, chest pain. A low amount of red blood cells makes your heart work harder to move oxygen-rich blood through your body, leading to irregular heartbeats called arrhythmias, heart murmur, an enlarged heart, and or heart failure. Severe deficiency can cause neurological problems like confusion, dementia, depression, and memory loss. Tingling and numbness in your hands and feet are a symptom, as are muscle weakness, loss of reflexes, unsteadiness, loss of balance, and or trouble walking. Can lead to weakened bones that may lead to hip fractures. An enlarged liver is also a symptom. Now, the symptoms of a vitamin B12 deficiency can involve the digestive tract, and they include nausea, vomiting, heartburn, abdominal bloating and gas, constipation, diarrhea, loss of appetite, and weight loss. So as you see here, we have a lot of overlap between the parasitic symptoms and B12 deficiency because, again, a lot of the symptoms caused by parasites are a direct result of the malnutrition that we end up suffering because they're consuming our food. Anyway, if you would like to learn more about the symptoms that I had, we're going to talk about those in a moment. All right, so here we go. These are intestinal parasite symptoms that I had. I don't get into detail in the timeline. That can be covered maybe in another time, but it's not going to be covered at this present moment. So on the following slides are symptoms that I personally experienced. These symptoms are commonly experienced by those with intestinal parasites. It is common to have more than one parasite. I had at least two. I may have had more. Fungal infections like caused by Candida albicans and parasites can often co-occur. Symptoms increase and get worse over time as the months and years go by. We become more nutritionally deficient and the symptoms will increase. Symptoms can also occur intermittently, sporadically, or on a regular basis. So I would say if you don't experience all of the symptoms here, don't think that you're free and clear. That's just my thing. That's my opinion. And there's a little joke there if you get that. So the parasitic infection symptoms that I personally experienced were abdominal swelling and pressure, and this became noticeable on my right side. I also had an increase in allergies. My seasonal allergies increased, and I became very sensitive to a lot of foods. Those included gluten, dairy, peanuts, and eggs. I can now eat all of those foods with no problems, just as a side note. I was diagnosed as a low red blood cell count, so I had anemia, anxiety, I would especially, which makes sense because if you have parasites inside you, they are going to cause those type of symptoms, and I started having some panic attacks. Back pain, bad breath, bloating, bowel upsets, churning stomach, brain fog, that was especially noticeable after eating gluten, constipation, depression, and that was more of a physical depression, not a mental depression. I'm a pretty sunny personality for the most part. Dermatitis, which I had a rash as well, which I discussed more in detail on that. Diarrhea, dizziness, I had eczema, which I call under the rash that we'll discuss in a moment. Excessive hunger, fatigue, lack of energy, food cravings. I ate a lot. I thought about food a lot too. Food sensitivities, again, that's just basically highlighting the thing we've already discussed. Foul-smelling stools, foul-smelling flatulence, gas, insomnia, intestinal pain and pressure. Of course, I had joint pain, very painful, actually. I had a lot of difficulty in the mornings, especially when I awoke. I was very concerned because I was only in my late 30s and I did not know what was causing my problems, and it was becoming much, much more difficult to do the things that I love to do, which are hike and bike and kayak and be active. So if you are having issues with that and any of these symptoms resonate with you, maybe discuss these things with your doctor. Also, I became very tired. It was hard for me to get going. I had difficulty going at the speed that I used to go, especially with biking, running, and I would just get very fatigued, short of breath. Of course, headaches were occurring, mood disorders, if we want to consider like anxiety, and I was definitely irritable, and that was definitely noted when I was treating myself for tapeworms as they were dying off. I was really not pleasant to be around. Mouth and canker sores I had a few times as well, especially on the tongue. Muscle aches and pains. Mucus in the stool, but I didn't notice that until later because I was not somebody that was actually looking at, I didn't check anything in the bathroom for years. That's just not the way I do it. If I want to go to the bathroom, I flush the toilet and go about the rest of my day. I'm not checking out what's going on in there. Now I do check out what's going on in there, but that's a whole other story. Nausea was common. Neuropathy, I was definitely getting a lot of numbness and tingling, especially in my hands, which was I did not like that at all. There was one night, I'll get into a personal story, that I lost my vision. I was getting ready for bed, and I don't drink, I don't do any drugs or anything like that. I eat very healthy, and I was already being treated by a doctor and, getting tested for different things. And anyway, I was getting ready for bed, and I wanted to read something, so I got up and I was picking out a magazine to read before I go to bed. I was in school, so I didn't want to read anything too heavy. Anyway, I couldn't see. My whole vision just started just like nothing. I couldn't focus on anything. And then I started getting the feeling in the left side of my body, especially my face and down my arm. And I was like, I knew. I was like, I'm going to have a heart attack or a stroke. So I called 911 and I waited very calmly because I knew if I would get upset, then that actually could be very detrimental. So I made sure to unlock the door before I sat down so they could just come in. And they did. And they took my oxygen reading. And they could not get a reading. So they gave me oxygen and got me stabilized. And, I kind of was okay. A little bit later after that, a few months, I gave up soy, and that helped because that was probably having an impact on my thyroid, and I thought that was the answer and everything was going to get better. But unfortunately, it was not the answer. It only kind of bought me a little time. The truth of the matter is I was infected with tapeworms. So that being said, that was a very serious thing, and it was very frightening for me. Okay. Anyway, sorry. All right. It was just a very frightening night. Nutritional deficiencies was also something that I had. Iron, vitamin D, vitamin B12. Iodine, of course, that caused the thyroid problems. Selenium as well. Of course, I had a rash. I was diagnosed with dermatitis. I had very red, inflamed, and painful skin. My hands were just a mess. They looked absolutely awful. I had really dry skin and really flakiness. I just, in the last few years before I discovered it, I mean, really, I was falling apart. There was no question, um, which is very disturbing. And it's also very disturbing that this went undiagnosed for so many years. Anyway, I also had restlessness, of course, stomach upset, stomach pain, sudden waking, especially within the first 2 hours of going to bed. I don't know if this is a timing issue of that time. I'd go to bed around 10:30, 11 o'clock, and I would wake up in basically an alarm state at 12:30 or 1 o'clock. Now I sleep through the night, so everything is good. Teeth grinding, of course, I did that a lot. I don't do that anymore. That's definitely not a good thing, and it's definitely a sign that there's something wrong. I thought I was just stressed. And anyway, vomiting, I did that very infrequently. One time that I really did it, and the other times maybe just, felt like I was going to do it. Of course, weakness, and, I'm a person that likes to ride my bike, and I like to hike, and I definitely saw a noticeable decrease in my ability. I take the stairs everywhere I go, and, I would be fatigued, short of breath, just going up a few flights of stairs, which is ridiculous. Of course, I'm still working on building up my nutritional deficiencies. Everything is going pretty good. I have no complaints. And anyway, we're just going to highlight real brief some of the symptoms of intestinal parasites. And this is just kind of a condensed version for people that want to do maybe a screenshot of this. Feel free to do so. And these are some common symptoms of intestinal parasites that are not necessarily specific to tapeworms. And I'll read through them quickly. Abdominal or stomach pain, swelling and or pressure. Bloating, bowel upsets, churning stomach. Anemia, nutritional deficiencies, malnutrition. Mood disorders. This can include anxiety, depression, irritability, and like I said before with Toxoplasma gondii, has been linked to schizophrenia and bipolar disorder. Bad breath, diarrhea, constipation, foul-smelling stools, and foul-smelling flatulence, gas, mucus and stools. Dizziness, lightheadedness, fainting. I did all of those things, by the way. I also had seizures, which I have failed to mention in the previous section. Fatigue, lack of energy, lethargy, weakness, excessive hunger, food cravings, food sensitivities, allergies, especially gluten and or dairy. Headaches, migraines, teeth grinding, itching around the anus. This is especially typical for someone infected with pinworms. Joint pain, muscle aches, back pain, nausea, vomiting, neuropathy, numbness and tingling in extremities, brain fog, poor attention, lack of concentration, restlessness, poor immune function, and weakened immune system. Skin issues, dermatitis, eczema, rash, acne. This can be itchy, could be red, could be inflamed, painful, tender, blistering, or weeping sores. Someone may also have dry, scaly, itchy patches on part of their body. Sleep issues can include insomnia, sudden waking, and also sleepwalking is another common one as well. I want to say that actually on this list, which is very sad, I had all of these as well, except for the pinworms one. That's the only one I did not have. I have a very poor immune function that my white blood cell count for years was considered dangerously low by all of my doctors. But they did not have any answers as to what was causing it. Now I have a better idea of what was causing it. Anyway, that being said, these are some of the symptoms that are common with intestinal parasites, and I just want to make a few more remarks. Parasitic infections cause the same symptoms attributed to many autoimmune disorders and other health issues, including celiac disease, non-celiac gluten sensitivity, and gluten intolerance. It also shares the same symptom profile as rheumatoid arthritis, irritable bowel syndrome, irritable bowel disorder. As we've seen, there's also a link between colitis and Crohn's disease. We see that fibromyalgia is also the same, can be attributed to parasitic infections, could have the same kind of profile. Chronic fatigue syndrome as well, thyroid issues, and infertility. I had issues with my thyroid. Infertility was also an issue as well. I had issues with gluten, and one could say I had IBS as well, but I was never officially diagnosed, but I certainly had a very irritable bowel, to say the least. I also had very serious fatigue syndrome, and I also had what one would call fibromyalgia. Anyway, those are just clusters of symptoms for the most part. You can do with this information what you will. I hope that's been a benefit to you. I really want to thank you, my gratitude and love. You know, I went through a very hard time, and I really just want to take this information and present it to people. So if they're suffering from something very similar, that they don't go through what I did to actually find out so late in the game that I was infected with parasites. I'm really hoping that this information will help somebody a lot earlier before it gets to be a very serious health issue like it had become for me. Anyway, that is my hope and that is my goal. If you do want to support me in any way, I would appreciate it. I have a Patreon site. There's definitely a lot of great rewards I give. I do private videos where I get into a little more detail about my personal story and about how I treated my infection. If people are interested, I make a lot of posts. And I also have a PayPal account if you're interested in that. But if not, please just take this information and hopefully use it in a way that will help you and help others. If you would like to subscribe and want to learn more about intestinal parasites, I would greatly appreciate that. If you like this video, please hit the like button. If you'd like to share it, please do. If you'd like to be notified when there's new videos, please click this little button here of the bell and it'll notify you. I will warn you, I'll be putting up a lot of videos on wild edibles, and if you're not interested in wild edibles and don't want to be notified about videos, then just check back every so often and definitely subscribe. I would really appreciate it. I thank you. I hope you have a wonderful day. Thank you for taking the time to listen to my video and listen to my story. I hope it is of a benefit. Like I said, have a wonderful day. Peace and love.